There's a $1 bottle in the back of your medicine cabinet right now that kills drug-resistant bacteria, purifies contaminated drinking water, eliminates household mold, and treats infected wounds faster than any prescription antiseptic on the market. Not a supplement, not an alternative remedy. A documented chemical compound that the United States military deployed across 2 world wars, that NASA selected to sterilize drinking water aboard the International Space Station, and that hospital emergency rooms used as their primary wound irrigation agent for over 60 years. Then the pharmaceutical industry found a way to repackage the same molecule at 10 times the price, flood the market with branded antiseptic products, and quietly reclassify the $1 bottle as a crude, outdated home remedy not suitable for serious medical use. They did not replace it because the science moved on. They replaced it because you cannot build a billion-dollar wound care product line around a liquid that costs $1 at any grocery store on Earth. This is the story of hydrogen peroxide, the compound that Armies trusted, that NASA chose, and that a $30 billion antiseptic industry spent decades teaching you to underestimate. The molecule itself is almost absurdly simple. 2 hydrogen atoms bonded to 2 oxygen atoms. H2O2. 1 oxygen atom, more than water. That single additional oxygen atom is the entire source of its power. When hydrogen peroxide contacts biological tissue, it releases that extra oxygen atom in a rapid decomposition reaction. The released oxygen creates an oxidative environment that destroys the cell membranes of bacteria, viruses, and fungi on contact. It does not discriminate between bacterial species. It does not require the bacteria to have a specific receptor that a pharmaceutical compound can target. It attacks the fundamental structural chemistry of microbial cell walls directly. This is why bacteria cannot develop resistance to hydrogen peroxide the way they develop resistance to antibiotics. There is no mechanism to evolve around oxidative destruction. The chemistry is too fundamental, too direct, too simple to circumvent. The compound was first isolated in 1818 by a French chemist named Louis-Jacques Thénard. He produced it by reacting barium peroxide with nitric acid and documented its powerful oxidizing properties immediately. Within decades, European physicians were experimenting with dilute hydrogen peroxide solutions as wound irrigation agents. By the 1860s, as Louis Pasteur's germ theory was beginning to reshape medical understanding of infection, hydrogen peroxide's mechanism of action suddenly had a scientific framework to support what physicians had been observing empirically for years. The compound killed the organisms that caused wound infections, not because anyone fully understood the oxidative chemistry yet, because the clinical results were consistent, rapid, and observable. By the 1880s, hydrogen peroxide was being produced commercially and distributed to hospitals across Europe and North America. American dental practices adopted it for oral infection treatment and gum disease management in the 1890s. The compound required no special storage beyond keeping it away from light and heat. It required no prescription. It cost almost nothing to produce, and it worked on every category of microbial contamination that physicians encountered in daily clinical practice. That combination of properties made it the most widely distributed antiseptic compound in the world before the First World War began. When the war opened in 1914 and the scale of battlefield wound infection became immediately apparent, hydrogen peroxide was already the standard tool in every military field hospital on both sides of the conflict. Surgeons irrigating shrapnel wounds in forward dressing stations used hydrogen peroxide solutions to clear bacterial contamination before closure. Field medical manuals from the British Expeditionary Force, the French Army Medical Corps, and the American Expeditionary Forces all document hydrogen peroxide as primary wound irrigation protocol. Trench warfare created wound infection conditions that no previous military medicine had encountered. The combination of soil contamination, organic debris, and anaerobic bacterial species in deep puncture wounds produced infection rates that overwhelmed standard treatments. Hydrogen peroxide's ability to release oxygen directly into deep wounds created an environment chemically hostile to the anaerobic bacteria responsible for gas gangrene, the infection that was killing soldiers faster than artillery in some sectors of the Western Front. Military surgeons documented case after case where hydrogen peroxide irrigation of contaminated wounds prevented the anaerobic progression that would otherwise have required amputation or resulted in death. The compound was not just useful on the First World War battlefield, it was essential. Between the wars, hydrogen peroxide expanded into civilian industrial application. Food processing facilities used it for equipment sterilization. Municipal water treatment plants in several European countries tested it as a disinfection alternative to chlorine. Textile manufacturers used it for bleaching without the residual chemical contamination of chlorine-based processes. The compound's versatility was becoming apparent across industries simultaneously, and its cost remained almost nothing, a property that would eventually make it a target rather than an asset in the emerging pharmaceutical economy. When the Second World War began and the American military mobilized its medical logistics at a scale never previously attempted, Hydrogen peroxide was again standard issue in field medical kits across all theaters of operation. Pacific Island combat produced wound infection challenges even more severe than the Western Front had generated 25 years earlier. The combination of tropical humidity, soil microorganism diversity, and the impossibility of maintaining sterile field conditions in jungle combat created infection rates that required aggressive irrigation protocols. Military medical records from the Pacific Theater document hydrogen peroxide irrigation as the first-line response to combat wounds from Guadalcanal through Okinawa. The compound was cheap enough to stockpile in vast quantities, stable enough to survive tropical storage conditions, and effective enough that field surgeons trusted it over every alternative available. The United States military ran the largest uncontrolled clinical trial in the history of wound care across 2 world wars, and the conclusion was consistent across both. Hydrogen peroxide worked. After 1945, the pharmaceutical industry had the same problem with hydrogen peroxide that it had with every other inexpensive natural compound that the war had validated at scale. Companies like Johnson & Johnson, Pfizer, and the emerging antiseptic product manufacturers had invested heavily in developing branded wound care product lines during the war. Iodine-based antiseptics, quaternary ammonium compounds, and eventually antibiotic-impregnated dressings all represented patentable, manufacturable, marketable products that could be sold to hospitals, pharmacies, and consumers at significant margins. A clear liquid that any person could buy for $1 and that the entire military medical establishment had just spent 6 years proving was highly effective was not a product opportunity. It was a market threat. The suppression did not happen through a single decision in a boardroom. It happened through the accumulation of 1,000 smaller ones across 3 decades. Hospital procurement departments were presented with branded antiseptic products, backed by pharmaceutical sales teams, glossy clinical literature, and volume purchasing incentives. Medical schools began receiving research funding from pharmaceutical companies whose product lines competed directly with hydrogen peroxide applications. Wound care curricula gradually shifted toward patented compounds. By the 1970s, a new generation of physicians had been trained in clinical environments where hydrogen peroxide was described not as the military-validated compound it was, but as a tissue-damaging relic of outdated practice. The criticism that emerged was technically accurate in a narrow sense. Concentrated hydrogen peroxide at high percentages does damage tissue, but the concentration that damages tissue is far above the 3% solution sold in grocery stores, and far above the diluted irrigation concentrations that military surgeons had used safely for 60 years. The industry took a real limitation of one formulation and applied it universally to discredit every application of the compound across all concentrations. It was the most effective piece of chemical misdirection in the history of consumer medicine. NASA did not receive that memo. When engineers designing the International Space Station water recycling system needed a sterilization compound for the closed-loop water supply that would keep 6 astronauts alive in orbit, they selected hydrogen peroxide. Not because it was cheap, though it is, because it was the most effective, most stable, and safest oxidative sterilization agent available for a system where chemical residue in the water supply was an unacceptable risk. The compound that the pharmaceutical industry had spent 30 years reclassifying as a primitive home remedy was simultaneously the compound that NASA trusted to keep human beings alive in space. The gap between those two characterizations is not science, it is marketing. The research record that accumulated outside pharmaceutical influence tells a consistent story. A study published in the Journal of Hospital Infection tested hydrogen peroxide vapor sterilization against methicillin-resistant Staphylococcus aureus, the drug-resistant bacterial strain responsible for over 90,000 severe infections in the United States annually. Hydrogen peroxide vapor achieved complete eradication of MRSA contamination on hospital surfaces where standard chemical disinfectants had failed. A review published in the American Journal of Infection Control examined hydrogen peroxide's efficacy against Clostridium difficile, the bacterial infection responsible for nearly 30,000 deaths per year in American healthcare facilities. The review found that hydrogen peroxide vapor outperformed quaternary ammonium compounds, the primary active ingredient in most commercial hospital disinfectants, across every tested surface material and concentration. The compound that costs $1 is outperforming the compounds that cost $50 per application in controlled hospital infection research. The pharmaceutical industry's response to this data has been to ensure that it appears in academic journals rather than pharmacy shelves. Here is exactly what the $1 bottle in your cabinet can do at the correct concentration and application. The standard 3% hydrogen peroxide solution available at any grocery store or pharmacy is the correct concentration for household antiseptic, wound care, and surface disinfection use. For minor wound irrigation, pour the solution directly over the wound surface and allow the characteristic fizzing reaction to occur for 30 to 60 seconds. The fizzing is the oxidative decomposition releasing oxygen directly into the wound tissue. It is not damaging the wound. It is creating an oxidative environment that destroys bacterial contamination at the cellular level. Rinse with clean water after the reaction subsides. For oral use against gum infection and mouth sores, dilute the 3% solution to a 1.5% concentration by mixing equal parts with water. Use as a 30-second rinse and spit completely. Do not swallow. For household mold treatment on hard surfaces, apply undiluted 3% solution directly to the affected area. Allow 10 minutes of contact time and wipe clean. The oxidative reaction destroys the mold structure rather than simply suppressing surface growth the way bleach-based products do. For water purification in field conditions, add 8 drops of 3% hydrogen peroxide per liter of clear water and allow 30 minutes of contact time before drinking. For turbid water, filter particulate matter first, then treat. This delivers a disinfection effect comparable to standard iodine tablet treatment without the persistent chemical taste or the iodine contraindications that affect thyroid function with prolonged use. Military field medicine used this protocol across multiple theaters of operation for good reason. It works, it is safe, and the active compound breaks down into water and oxygen after the disinfection reaction completes, leaving no chemical residue in the treated water. Store hydrogen peroxide in its original dark container away from heat and light. The compound degrades into water when exposed to light, which is why the brown bottle exists. A properly stored bottle maintains effective concentration for 6 to 12 months after opening. Check potency by pouring a small amount onto a dark surface. Active 3% solution fizzes immediately on contact with organic matter. If there is no fizzing reaction, the compound has degraded and should be replaced. At $1 per bottle and a 12-month shelf life, the annual cost of maintaining an effective antiseptic, disinfectant, water treatment, and wound care solution in your home and field kit is $1. The branded antiseptic products filling pharmacy shelves charge between $8 and $30 for compounds that address a fraction of the applications that hydrogen peroxide handles from a single bottle. Louis-Jacques Thénard isolated this molecule in 1818. European physicians were using it in clinical wound care before the American Civil War. The entire United States and Allied military medical establishment used it as primary wound irrigation through 2 world wars. NASA selected it for the International Space Station. Hospital infection research continues to document its superiority over patented synthetic disinfectants against the most dangerous drug-resistant bacterial strains in modern healthcare. And yet the $1 bottle sits in the back of your medicine cabinet, undertrusted and underused, while the pharmacy shelf in front of it holds $30 branded products containing compounds that perform worse in controlled research conditions. The molecule did not change. The bacterial infections did not change. The oxidative chemistry did not change. What changed was who controlled the information environment around it and what that control was worth. A $30 billion wound care and antiseptic industry was built on the foundation of making you forget that the most effective compound in the category costs $1 and has been sitting in your cabinet the entire time.